My name is Dr. Conrad Murray. This is part of the untold story, my story. This is the very first time I have made this statement publicly that analyzes the case that was brought against me, Conrad Murray versus the state of California. A lie unchallenged becomes the truth. If Michael Jackson was on a Propofol infusion or a drip, I would be completely responsible for not monitoring him. But he was not. And here is why. Michael Jackson was a chronic insomniac for decades, meant he was not able to sleep as a normal human being. At times, he was treated by the physicians and others with intravenous Propofol, a powerful sedative. Dr. Murray, his friend, and doctor since 2006, was hired in 2009 to be his personal physician for his worldwide tour. This is it. When Dr. Murray learned of Michael's reliance on Propofol, he devised a successful plan to wean him off the drug. Michael died in June 2009, and his primary cause of death was determined to be a lethal dose of Propofol with benzodiazepine effect, Lorazepam. The Los Angeles District Attorney charged Dr. Murray with involuntary manslaughter, asserting that he abandoned Jackson while leaving him unsupervised while on a 3-hour Propofol infusion or a drip. The DA's deception certainly had several missing links, including this 100 milliliter vial of Propofol, which you see on the screen, that carries 1,000 milligrams of the medication. What is the significance of this bottle? This bottle has not been tested by the defense, and to this date we have not been allowed to test the contents of this bottle, simply because it has been controversial with the defense team and the court. The defense has not been allowed to test the contents of the bottle, and this remains a mystery up till this time. The key prosecution's medical expert, Dr. Stephen Shafer, gave his opinion as far as the cause of death. Shafer's opinions were apnea, which is the cause of Michael Jackson's death, and that means that he stopped breathing. He also stated that Michael Jackson was on 100 milliliter Propofol infusion infused over a 3-hour period, starting at 9 o'clock and ending around 12 noon, which is the time he died. He also stated and claimed boldly that Michael Jackson died on a Propofol infusion drip that was running. Other issues with the case involve alteration of evidence inside and outside of the court by court officials, and there were clearly a number of collusions between the chief prosecutor, David Walgren, with witnesses, aligning their statements, especially that of Alberto Alvarez, Elisa Fleek, and Dr. Stephen Shafer, the chief medical expert for the prosecution. Shafer's theory: Michael Jackson was in a Propofol infusion for 3 hours, starting at 9 to 12. When Shafer testified on the Propofol concentrations, which was on day 14th of the trial, and the reference is shown in his own words, Dr. Shafer stated the following. And this is important to remember. When you give a drug slowly with a drip, there is not much difference between the blood and the brain concentrations. And basically he's saying that over a period of time, once a drip continues to be continuous or infused continuously in a patient, the cells in the body, the organs, the fat cells, the muscle cells, the brain, the blood, they're all raised to an equilibrium state where the values show very little differences between each other. And here we look at a graph that he presented to the jury. As you can see on the left, there is propofol infusion, and on the y-axis, it states concentration of propofol from 1 to 6 micrograms per milliliter. On the x, starting at 0, you see what we refer to as 9 o'clock to 12 o'clock. I'll just point here with my finger so that you can see. This represents 9 o'clock, and this is a curve that climbs up to the concentration that was found in the femoral blood at autopsy, roughly 2.6 micrograms per ml. Interestingly, as you look at this curve and you look just above, you'll see that there is a broken line that represents blood and a solid line that represents brain. But when you look at that curve that he proposes, represents the concentration of propofol in Michael Jackson's blood and brain, the curves are, again I will point, are superimposed on each other. The curves are not separated, meaning, in reference to his prior statement, when a medicine or drug is given by a drip, and in this case propofol, there exists no difference between the blood and the brain concentrations after a while.
With Michael Jackson dying on an infusion, a drip of propofol.
On this slide, Dr. Shafer blows up the last few hours narrowed to noon, where you saw that curve on the prior graph. And what we are looking at here, he starts at 9 o'clock, at which time the drip or the infusion of propofol was supposedly started. So we see here 9, 10, 11, and 12. At 12 o'clock, there is a drop in the curve. And this represents Michael Jackson's death at this time, approximately 12 o'clock. The curve declines rapidly within about 5 minutes. And what he proposes is that had I been there with Michael Jackson, if he was on this supposedly infusion of propofol, all I would have had to do is to stop the medication and Michael Jackson would be fine, because if he stopped breathing as a result of what caused his heart to stop, the heart will beat for about 10 minutes thereafter if apnea did occur, but it did not.
I just wanted to blow up the scale from 9 a.m., where I'm suggesting the infusion starts, till noon, and then if he was alive here, to show you how fast the levels fall. So that right here, even if he stopped breathing here, look how quickly the levels fall. This is the femoral vein concentration. It only touches that for a moment, and then, let's see, this is 1 hour, so that's 30 minutes, that's 15 minutes. So at 12 o'clock, by 5 minutes after 12, the femoral blood, the blood level is once again much lower than what was measured on autopsy.
According to Dr. Shafer,
the flow of oxygen into Michael Jackson's lungs stops sometime in here, actually before noon. I'm going to say perhaps at 10:45, around 11:30, 11:45, the flow of oxygen into Michael Jackson's lungs stops. And with the lack of oxygen going into his lungs, in 10, 15, 20 minutes, the lungs no longer have enough oxygen for the heart, and the heart stops. And with the ending of circulation, Michael Jackson has died, but he's died with the infusion running. And that's why the levels are high. He has died with the infusion still going.
To simply qualify what Shafer is stating there, is that apnea, which represents the lack of breathing, when somebody stops breathing and there becomes no oxygen in their body, it's depleted of oxygen. The heart does not stop immediately when somebody stops breathing. The heart beats for about 9 to 10 minutes thereafter. A good example would be say, a child who drowns in a swimming pool, unfortunately, or any adult who drowns, when the lungs becomes filled with water, there is absolutely going to be a lack of intake of continuous oxygen, and eventually the body is going to deplete its stores. But while the lung is no longer able to do its job, the heart continues to pump. It continues to pump blood around the body and circulation is maintained. And once the heart continues to beat, there is ongoing metabolism. So that's an example of what Dr. Shafer is saying there. So if you die from apnea and have asphyxial cardiac arrest, the heart does not stop until an average about 9 to 10 minutes after the lung stops doing its job.
All of the data in this case, and I am not aware of a single piece of data that is inconsistent with this explanation.
Medical opinion about certain things, is that right?
That is correct.
And one of the medical opinions you stated was the actual occurrences that happened in Michael Jackson's room on June 25th, 2009.
Testimony.
Overall,
Isn't that right?
please repeat the question.
One of the things that you were asked your opinion about, that you testified to yesterday, were the actual occurrences, the actual IV setup, infusion, how Michael Jackson received the propofol that was in his body. Isn't that right? Is that not your
The nature
opinion?
of the question is, was I asked to do that?
Although Dr. Shafer testified that the actual occurrences that happened in Michael Jackson's bedroom that night incorporated a number of concoctions, including false IV tubings, the different type propofol vial, and additionally, there was no infusion. As a result of that, Dr. Shafer's testimony was absolutely false, because none of his demonstrative equipment happened to be evidence in this case. This is an example. It's a schematic diagram that summarizes Dr. Shafer's testimony. As you can see, the infusion of saline that's being washed through the tube combines at the point with propofol, which then runs into Mr. Jackson's leg. This is the concoction that was presented to the jury. This represents a cut saline bag with a bottle of propofol being hung from inside of the bag. That is absolutely useless, and it's not a theory that I have ever seen. Actually, the very first time I encountered this presentation was in the court, even though my past experience working as a critical cardiologist and being exposed to propofol and its use for so many decades, I had never seen anybody done that with the propofol vial. It comes with its own simple hanging sleeve. It is as very simple like going to a friend's home and they're offering you a can of soda. What you do with a can of soda, you pop the cap, you drink the soda. Propofol is as simple as that. There is a hanging sleeve that needs to be popped and it hangs the bottle directly. There is no reason whatsoever to empty a bag of saline, cut a hole in the bag, stick the bottle in the bag, and then use the empty bag as a hanging device. That's a contraption that I have never seen, ever. But this is what he proposes. So this empty cut saline bag is shown there, and this is the long tubing that goes into Mr. Jackson's leg. As you can see, the propofol goes directly into Michael Jackson's vein. So I would assume that the tip of this catheter should demonstrate blood. It's a small peripheral vein. As you will see in the later part of this discussion, Dr. Shafer describes this tubing that he brought to court, his own tubing, not evidence, that the distance between this end and up to the J port, which is the Y port here, measures roughly 3 feet. That is totally contrary to the actual evidence item, which would be a saline bag with a tube in, and a short distance away from the Y port, there is a 6-inch basic length of the tubing, not 3 feet. For all of you who are not familiar with cardiology or working with the vascular bed on patients, a small peripheral vein, if one draws back with a syringe or any kind of suction on that vessel, it would collapse. It is just too small and would not be able to transfer 3 feet, over a 3 feet distance, blood all the way back to this component. If you look at the saline bag now, you see that the saline is yellow and the entire proximal, which is this area of the tubing, is also yellow. As you look from the Y port injection site and below, it is seen as white in color, which looks like Propofol. This was an actual evidence item discovered at the scene. I did admit to the police that I gave Mr. Jackson 25 milligrams of Propofol infused very slowly over 3 to 5 minutes, which is the recommendation from the manufacturers as well as that of the FDA. If you look at the tip of this catheter, where it's joined by a needle that Shafer proposes joins the Propofol line that's going straight into Mr. Jackson, you don't see blood at the end of this catheter, but the discovered item showed blood in this portion of the catheter, and the blood was consistent with Michael Jackson's blood, which strongly suggests that this catheter was into Mr. Jackson's IV site. It goes further. The court and Dr. Shafer proposes that Dr. Murray absconded. He left quietly and very quickly from the scene with this tubing, which was Propofol. This tubing has never been found because this tubing never existed. Michael Jackson was on a saline drip the night he died. It also shows you that the medication that I gave Michael Jackson was discovered in the area of the tubing that I said I gave him an injection, the Y port. If you look at the findings of the autopsy report and the toxicology, these items were tested. This bag was tested completely free of any medication, only saline. This proximal region of the tubing was also tested completely negative for normal saline. But all the medications I stated that I gave Mr. Jackson was clearly shown in this very short 6-inch segment here towards the end of the tubing. And again, the blood on the tip of this catheter demonstrates that this catheter was into Mr. Jackson's vein. Okay? And this is the reason why it says, why were the blood droplets there? And the clear indication is there was no dual tubings on Mr. Jackson. Dr. Shafer purports that there were 2 tubings. 1, 2. Neither tubings that he brought to court was ever evidence. The tubings that he showed to the DA and showed to the jury especially was clearly different to the actual evidence item. I have never given Michael Jackson a Propofol infusion using 2 IV lines. This is not true. This is basically a phantom drip. This is a test of his hypothesis, but it's a test that did not exist. As we go further, you would see the findings of the toxicology report, the testing of the actual evidence items, and you will understand there was no evidence, neither as a fact. There were no 2 tubings used to give Michael Jackson a propofol infusion on June 25, 2009. It shows the white propofol mixture going through the proximal tubing and all the way down into the vein of the patient. This shows the Y port at the lower end of the propofol mixture, catheter insertion site. This would be the method that I would use at all times if I had to give Michael Jackson an infusion of propofol. And the last time Michael Jackson received any kind of propofol from me was about 3 days prior to him dying. And he did not have a propofol infusion that day. If he did have a propofol infusion running that day and consistent with the method that I would use, they would have found propofol in the IV bag. They would have found it in the proximal, the distal tubing, as well as in the Y port. It's an emulsion. It's very thick. It's as thick as running honey or molasses through this tubing or this bag. It adheres very significantly to the components involved in the IV tubing. But basically, when you mix a propofol drip like this, you drain the contents of the propofol vial into the bag. Or you may extract it with syringes, and there is a little nipple. You can inject the propofol into the bag. You will shake it. If so, an example would be, what if I wanted to give 1,000 milligrams of propofol in 1,000 mLs of saline? I would take one of the large bottles, I would drain it into the bag, or I would extract it by using a syringe multiple times. And once the propofol is into the bag, I would then shake it together and I'll have a concentration of 1 milligram per ml of propofol. If I wanted to make it a stronger concentration, if I wanted it to be 2 milligrams per ml, I will use 2 vials of the 100 ml propofol, which carries 1,000 milligrams. What if I wanted to make it 1.5 milligrams per ml? I would then get a couple of the smaller vials, which are the 200 milligram vials, combine that with a large one, drain it into the bag, and shake that together, and I'll have a dilution with a concentration of medication that I could use as an infusion into Michael Jackson. And I do not need 2 IV tubings. All it requires is 1 tubing, nothing more. Toxicologist Dan Anderson, he would now tell you the findings of his propofol analysis and what was actually done at the coroner's office in testing. According to Ms. Dr. Anderson, propofol, no drugs were detected in the IV saline bag, which is the bag you saw in the prior diagrams. No drugs were detected into that proximal part of the tubing, which is the very initial tubing that comes out of the bag that drains down to the patient before that junction where you saw the Y port. No drugs were detected in the lower portion of the IV tubing, except where the Y port was seen and thereafter, which is consistent with Michael Jackson receiving normal saline. It's also consistent that the drugs that they detected in the lower portion of the tubing, which I had shown you on the prior slide, where it was not yellow but was shown as white in the Y port, drugs were detected there, medications. All of the medications I said I gave him were all discovered at that point. Nothing in the bag. Nothing in the bag, as Alberto Alvarez stated. He had seen a white milky substance in the bag. He had seen a bottle in the bag. That did not happen. Here are the concentrations that the doctor detected, the toxicologist. In the vitreous fluid, which is a very small amount of fluid that's in the posterior chamber at the back of the eye, they found a concentration of 0.4 micrograms per ml. In the femoral vein, which is nearer the groin, they found a concentration of 2.6 micrograms of propofol. And if you look at the heart there were 3.2 micrograms per ml, the liver being 6.2 micrograms per ml. This is important because when you look at the concentrations here, in actuality, it does not fit Dr. Shafer's theory. Dr. Shafer said that when a drug like Propofol is given over a long period of time, and we talk about 9 o'clock to 12 o'clock, that was 3 hours. You remember that slide? You remember his statement where he said, there is little or no difference between the levels in the brain and that what you find in the blood? Well, he said you could not also find a single piece of evidence to refute his claim. Here's an example. Example 1. The concentration of propofol in the back of the eye is not 2.6 as the femoral. It is not 3.2 as the heart or 6.2 as in the liver. Everything here, these concentrations are splayed. They are totally different. They are not the same. There is no equilibrium. And therefore, if the concentrations are not closely equilibrated, it means that there was no drip. Not a single drip. If you go back, which I will flip back to now, just to remind you, and I think it's important, look at this curve. And again, the broken line and the solid line from 9 o'clock to 12 o'clock are all superimposed on each other. They are not separated. The concentrations in the brain and the blood should be the same. The closest thing that we have to the brain is the concentrations in the back of the eye. And why don't we have a brain concentration? That's what I'm going to tell you next. Dan Anderson, in summary, said the following. The concentrations of propofol in Mr. Jackson's body was consistent with propofol being in the body for a very short period of time. Very short period of time. It is completely inconsistent with propofol being infused continuously as a drip. Between 9 a.m. and 12 noon, over 3 hours, there would have been equilibrium. The numbers I just showed you in the vitreous, less than 0.4 micrograms per ml. In the femoral, 2.6. In the heart, 3.2. And the liver, 6.2. Are not equal. It is consistent with the medicine being in the body for a very short period of time and completely refutes the hypothesis of an infusion by Dr. Shafer's own words. The defense theory of the case is that Michael Jackson died from cardiac arrest by self-administering a 25 milligrams rapid bolus of propofol and oral Lorazepam. Oral Lorazepam. Michael Jackson, more than anything else that day, was suffering from a condition completely unbeknownst to me. I never knew Michael, who was a friend of mine, was a drug addict. I never knew that Michael played with substance like that. He never shared that with me. We spoke about that, about a drug addiction, and I may have put a fear in Michael. The fear is that, I did not tolerate it at all. I don't smoke, I don't drink. I've never used illicit substance. I've never taken a draw on a cigarette, much more for marijuana. And Michael knew that I would stay so far away from those things that I knew that in my heart today, when I look in retrospect, if he knew or felt that there was any chance I would leave him by having that kind of knowledge, he kept it very hidden from me. Clandestinely and surreptitiously, Michael was using these substances. And apparently a lot of people in the camp knew about it, but not a soul shared it with me. And that night, as you will see later on, this becomes important. Insomnia exacerbated, worsened. And why? Because Michael was going through withdrawal, full withdrawal. After being on opiates for years and years, as the records will show, and being an opioid addict, his medication was stopped abruptly within 48 to 72 hours of his passing. And that night, Michael's insomnia was worse because he was in withdrawal, and I did not know that. Had I been aware of that information, Michael would have been somewhere getting treated for withdrawal. I have never given Michael Jackson Demerol. Never, ever have I given him such a substance. Just to reiterate on Dr. Shafer, I am sure that if not all of you, but many of you have heard that I used Propofol in Michael Jackson's home. The picture was painted that I was the only doctor that would ever consider doing such an act. Dr. Shafer made sure the world, as well as the district attorney, Walgren, knew that Dr. Murray would be the only one on earth who would consider using Propofol in the home. The fact is, yes, I used Propofol in Mr. Jackson's home, but I met Mr. Jackson with a stash bigger than I had ever seen as an individual. And I tried to get him off that substance, and I was successful up till 3 days prior to his death. The problem is, I was not aware of his opioid addiction. It was not Propofol. Propofol is not a substance that causes addiction, dependence. It is not a controlled substance. It has basically no street value. It does not give you a high. It is a legal substance. I was licensed to prescribe it. I chose to get Michael Jackson off the medication, but I had to do it slowly, and it was the way I designed to get it off. In retrospect, you can say, well, maybe I should not have done it that way. And if that's your opinion, I'm not going to go up against you. But the fact is, I met him with a substance, and my goal was to get him away from it. But by the time Michael got into trouble, and unfortunately he's not here with us, Dr. Shafer and the rest of the Los Angeles District Attorney's Office paints a picture that tells the world I would be the only doctor who considered using Propofol in that manner. Well, even the judge was convinced. Look at his statement. Judge Michael Pastor, in sentencing Dr. Murray to 4 years maximum time in jail, he said, I believe Dr. Murray is the only doctor on the planet who believes it is okay to use Propofol in the home setting. Dr. Shafer said it should never be done. Dr. Kamanga, all of the doctors that testified, it should never be done. And Dr. Shafer was the chief leading medical expert. And the judge accepted that that's the case, and he made this statement against me. But then look at this. Not so fast, Judge. Dr. Shafer disagrees with you. That's odd. Dr. Shafer just told the world it should not be done. The judge is convinced, and the judge says, I'm the only doctor on the planet who will use it. Well, here is a case. Propofol administered in a home environment. Who is the expert? Dr. Stephen Shafer, the same expert who told the world that I was reckless in considering such a method of treatment. The use of Propofol in the home setting to Dr. Shafer is a non-issue. Propofol was given to a woman at home by her father more than 500 times for more than 5 years. In the home setting, Dr. Stephen Shafer is the medical expert on the case. He supports Dr. Robert S. Markman in the Office of Administrative Hearing case in California, the case number 201-203-0549. Dr. Shafer was defending Dr. Markman concomitantly while he was destroying me while giving his testimony. He declares on December 27, 2011, roughly 3 weeks after I was incarcerated for 4 years. I was incarcerated on November 7th, sentenced to 4 years maximum on November 29th. By December 27th, less than a month, Dr. Shafer makes his declaration in support of Dr. Robert Maxman, who had used this propofol at home for more than 500 times and more than 5 years, and his daughter. He said there were only 2 issues. Propofol for the treatment of chronic pain, of which there is no indication that propofol is an analgesic, it does not treat pain, or using a family member as a physician of last resort, which was the more important question for Dr. Shafer. Only 2 issues. The use of propofol in the home is not an issue for Dr. Shafer. Within 3 weeks of painting me as such a reckless physician for the world to see and the world to hear. This is a problem, because using propofol for chronic pain brings up a different level of treatment. Here's an example. Of these 2 issues, the most important is a family member of last resort, nothing about using it in the home setting. Shafer destroys one but defends the other, and you understand what that means. Shafer pushes Dr. Murray under the bus, November 2011, for using propofol for minimal, please pay attention, minimal sedation for the treatment of insomnia in the home setting. Minimal sedation, you go to sleep. This is what he does for Dr. Robert Markman. In December 2011, he defended Dr. Markman, who placed his daughter under propofol-induced general anesthesia. Why do I say general anesthesia? He said he was using it for pain. There is a point as you sedate patients, which is a continuum of sedation, to get one to go under, when they can no longer withdraw from painful stimulus. You can do anything, you can pinch them, you can stick forks in them, you can squeeze their nails. They cannot withdraw because they cannot feel pain. They're in a coma. They need life support measures. If Dr. Marksman was treating his daughter effectively for pain, where there is no indication of pain fibers that propofol works with, it meant that she was under general anesthesia in the home setting and could not withdraw because she could not have a response to painful stimuli. That's a significant difference. But Dr. Shafer is the medical expert who destroyed my image and within weeks has protected another doctor. Do you think something is wrong with that picture? It's up to you. I leave it entirely up to you to decide. But these are facts.
No, how do you get, there's...
Well, Doctor, your opinion, you do understand the difference between opinion and fact, don't you? Do you?
I'll sustain the objection.
You understand that everything you said in the last 2 days was your opinion. You do understand that, right? Do you understand that?
I stated my name, which I think is a matter of fact.
Just his name is the fact. Everything else was an opinion. All of the evidence that he brought to the court and showed the jury, his own IV lines, his own cut bottle to hang a saline bag, all of those were his opinion and ideas with the prosecution. The defense theory of the facts, the cause of death. Michael died from cardiac arrest, not apnea. He did not stop breathing, and that lack of oxygen caused his heart to stop. He had cardiac arrest, and once cardiac arrest occurs, he stopped breathing right away. There was no circulation, and metabolism, everything was shut down right there and then. he had a rapid 25 milligram dose of propofol administered, self-administered, and as a result of such, he had side effects, not the therapeutic effect that one would expect to occur from propofol. The effect site for the therapeutic effect of propofol is the brain. But if it is given inappropriately in a rapid bolus, right in, as they were saying during the trial, that causes cardiorespiratory collapse. In Michael's stomach, free, unbounded Lorazepam was found, which supports that it was taken orally. That, in addition to 2 injections that I gave him, one at 2 o'clock and one at 5 o'clock, was responsible for the level that was seen at autopsy. He also received another benzodiazepine called midazolam or Versed, 2 doses, one at around 3, the other at 7:30, and exactly as I told them, the concentrations at autopsy equated. Interestingly, midazolam is only in an IV form. Lorazepam could be found both in an oral form as well as an injectable. I gave Michael injectable Lorazepam, a total of 4 milligrams, 2 milligrams at 2 o'clock, 2 milligrams at 5 o'clock. But it is the result of the medications that he took surreptitiously in my absence, or when he was away from me. He swallowed tablets, and those pills caused his level to be what they were. And we talked about his exacerbated effect from opioid withdrawal, from Demerol. Michael became a drug addict from Demerol use. This was given to him by one of his Beverly Hills physicians, and who knows if others were involved. But he took enormous amounts, larger than large doses that I've seen or even given. I have worked in emergency rooms around the country, and I have never given more than 75 milligrams of Demerol to anyone, even after a motor vehicle accident. That's the highest dose I've given, and that's on a rare occasion. My average dose would be 25 to 50 milligrams. You would see shortly the kind of doses Michael was getting. And this is it. Dr. Arnold Klein and Michael's clandestine abuse of Demerol. 200, 200, 200, 200, 300, 200, 375, 300, 300. I mean, if you look at these dates, take for example right here, on April 17, 2009, Michael Jackson gets 300 milligrams of Demerol, IV. He also gets, a few days later, 200 milligrams. Between the 21st and the 22nd, he has gotten another 375 for a total of 575 milligrams of Demerol in 2 days. A couple of days later, another 300 milligrams. And it continues that Michael was getting these gargantuan levels of meds. If you look here on the 4th, 5th, on May 4th, 5th, and 6th, 900 milligrams of Demerol was administered to Michael Jackson at Dr. Arnold Klein's office. The judge in the case refused to allow Dr. Klein to testify. He refused to allow Dr. Klein's nurse to testify. He refused to allow Dr. Klein's office manager, who also told the defense that he had administered Demerol to Jackson, to testify. All of those witnesses were barred from the trial. All we were left to do is to work with the little medical record that clearly could be incomplete. We have no idea how Michael Jackson may have acted before when he was in withdrawal, that they may have been aware of. We had no idea if these records were complete, but this is what we have. The addiction specialist clearly supports the fact that with these large doses, it would show that Michael Jackson had tolerance for this medication. We've also heard in testimony that Michael was at times lifted down the stairs, the back stairwell of Dr. Klein's office to the car, very lethargic. So no one had ever shared with me this information. But it's important to look at the date of the 22nd. On the 22nd of June, less than 3 days before Michael died in number of hours, he received, by the records, his last dose of Demerol. When Michael passed, they were not able to find Demerol in his bloodstream, nor its metabolite. It was between 48 to 72 hours of his last dose, and apparently Michael was read the riot act that he should not go back to Dr. Klein. It was supposedly done by AG officials. I've learned that during the investigation and during the trial. Michael went completely cold off his medicine, out of his drug addictive agent. As a result, he was left high and dry, and he was propelled into a full-blown state of acute withdrawal from Demerol, from the lack of Demerol. How do you treat an addict when they depend on a substance? You give them the substance. Or you give them a substance that has components like that to help to bring them down in addition to additional medications. So in Michael's case, what he needed that night was not Demerol. It was not Propofol, excuse me. He needed to have Demerol. But since his supply chain was cut from Beverly Hills, he was on his own. And he had never shared that with me. So I had no idea why it was so impossible to see Michael like a hamster that night. Couldn't sit down, couldn't restless, looked as though he was out of the movie Thriller. And I could not imagine that he was doing something like this. Had I had any knowledge, his treatment would have been different. He would have been taken to a hospital for acute withdrawal from opioids, and he would have been treated accordingly. Demerol abuse, Dr. Klein. All of the evidence points to that, or that's the reason why Michael Jackson was in opioid withdrawal, and that's the reason Michael Jackson became illogical, irrational, and took matters into his hands.
At which someone would be at risk of apnea after taking Propofol would be between 1.3 and 3.3 micrograms per milliliter.
At 1.3, you have 5% of patients at risk. At 3.3, 95% of patients are at risk. It's not like you could go higher and be breathing fine. What that range actually tells you is where you transition from a couple people being at risk to everybody being at risk for apnea.
But the total range with that explanation would be between 1.3 and 3.3 for being at risk of apnea as a result of Propofol.
Well, above 3.3, everybody's apnea.
The 1.3 that you're hearing about is the concentration of Propofol. Propofol effect site is the brain. And you have to get to that minimal level for the most sensitive of patients to go into apnea. So if you had 100 people, for example, 5 of those people likely would stop breathing with a concentration of 1.3. 95 of them would not. But as you go to a concentration of, let's say, the mean of 2.3, 50% of those people would have apnea. And if you add 2 standard deviations above the mean, say to make it 3.3, then everyone will likely have apnea. As you can tell, when I showed you the actual numbers on the autopsy earlier, do you remember the number for the vitreous fluid in the back of the eye? You remember that number I gave you? What was the Propofol concentration? It was 0.04 micrograms per ml. That's way below 1.3, where the most sensitive of patients, 5 out of 100, will have apnea. The vitreous fluid in the back of the eye is the closest number for propofol concentration that we have in the brain. And the reason for that is because up till today, we have not had a brain propofol concentration reported by the district attorney or the coroner's office. Does that make sense to you? If the brain is the site that propofol sedates in order to stop someone from breathing and have apnea, wouldn't you believe that would you not take a sample of that brain and test the concentration if you were the coroner? You have tested the heart, you have tested the blood. You have gone in the back of the eye, in that little sac. You've aspirated that tiny drop of fluid to find the concentration of propofol in the vitreous. But up till today, you have not taken a slice of brain to test for the concentration? And that's why propofol is supposed to act? Well, could you think of any reason why propofol was never reported by the coroner? Is it because it was not there? It did not exist? It takes about 2 minutes for propofol to get to the brain in any appreciable amounts. That further supports the fact that Michael Jackson was not on a drip over 3 hours. And it supports what the toxicologist, Dr. Anderson, said. It was in the office for a very short period. It was in his body for a very short period of time. That's why the levels up to the eye is even so low. This is why the levels are scattered everywhere, and there is no consistency as you should see when you give an infusion. It is my feeling that propofol was not detected in the brain. It was not there. And if it's not there, it could not cause apnea in Mr. Jackson or anyone else. The fact is, if the reference for the brain is the vitreous fluid of 0.04 micrograms per ml, it is so far away from 1.3 micrograms per ml that confirms also that Jackson could not have died from apnea, because there was no propofol level in his brain that could even be construed to have caused apnea. And this is a picture of the brain to remind you when they talked about the effect site. For those of you who didn't know what they were talking about, they were just saying the therapeutic site for propofol to act is on the human brain.
What did the coroner say was his brain propofol level?
I do not find a measurement of the propofol level in the brain in the coroner's report.
Thank you. That's all I have.
Could you imagine? The coroner's report does not have a brain propofol level. That's equivalent to a guy walking down the street, the woman has been raped, they point their finger and they say, that's him. But refuses to test his DNA to see if there's any physical findings that could support that is the right person. This is absurd. It's unthinkable. Could you give me any reason at all? We know that propofol effect site, as I said, is in the brain. It requires a minimum propofol concentration of 1.3 micrograms per ml to cause apnea. Again, apnea means to stop you from breathing. In the most sensitive of individuals, is it unthinkable that the brain propofol concentration was never provided in this case by the coroner, whose primary job is to speak for the dead? As you remember, the autopsy vitreous fluid of less than 0.04 micrograms per ml is the closest level we have to the brain. And that, dear friends, is extremely low, and impossible to cause apnea in anyone. Here's an example I wanted to help you to remember. And it's based upon Dr. Shafer's hypothetical, talking about 9 to 12 noon, and allowing time for the drug to equilibrate throughout the body when given by an infusion. His own words. There is no difference between blood and brain level. You remember that. And this is a diagram that shows you the diagram of the human body. And what I've done here, we know that the blood Propofol level was 2.6 micrograms per ml. Therefore, if Michael Jackson was on a Propofol infusion, by Dr. Shafer's own words, there should be very little difference between the brain and the femoral blood. Tell me then, if the claim is that he was on an infusion, and Dr. Murray was so reckless and I abandoned my patient on an infusion, isn't it easy to have made the case by showing us the brain Propofol level? Wouldn't it have matched that of the femoral? Of course, if that was the case, but it was not. I've also shown in the liver 2.6, the heart 2.6, and the vitreous 2.6. And the reason why I've done that is to show you, to emphasize again, there should be no difference between blood and brain or tissue. Once Propofol reaches an equilibrium or state which by a constant infusion is going into a patient for hours. This did not happen. Here are the actual numbers next to it. The brain concentration is still not known. It was never given. But the vitreous, in reference to where it sits right below the brain, is less than 0.04. This is a typographical error. It should be less than 0.04, not 0.4. The heart blood is 3.2, the liver is 6.2, and the femoral is 2.6. According to Dr. Anderson, you remember, this is consistent with Propofol being in the body for a short period of time and inconsistent with Propofol being administered by an infusion or a drip. I hopefully wish this picture can help you, but in case it doesn't, let me show you another way to look at it. These are the organ system we talk about. Here's the femoral vein, the liver, the heart, the brain, and the vitreous, which is the area, the little sac of fluid at the back of the eye. This column shows you, according to Dr. Shafer's statement, what you should expect if an infusion is being run over 3 hours. You see the numbers? 2.6, 2.6, 2.6, in every one of these organ systems. Basically no difference. Look at the numbers though, the actual numbers for Michael. 2.6 in the femoral, 6.2 in the liver, 3.2 in the heart. The brain remains unknown. And the vitreous fluid, again, typo, less than 0.04 micrograms per ml. So based upon the numbers of the actual autopsy, it refutes Shafer's hypothesis that there was an infusion. It refutes his claim that not one single piece of evidence could refute his claim that there was not a Propofol infusion that day. He states that Michael Jackson died with a drip running. If Michael Jackson died with the drip running, it meant that he would have stopped breathing. 10 minutes after, his heart would have also stopped. So now he's dead. And if that drip continued to run, it would have been draining into his femoral vein, which is where his IV was going to be draining first, in his leg, to the groin area. And therefore, the propofol, before it's pumped anywhere in the body, because it could not be pumped, would have had the highest concentration in the femoral area. Not the 2.6 as shown there. If a drip continued to run on Michael, his femoral vein should have been heavily concentrated with the most propofol, because by that time when he dies, his heart is no longer pumping. It cannot distribute the blood anywhere. That's not the case. Again, there was no infusion of propofol that day. If, as I said at the beginning of this discussion, if Michael Jackson was on a propofol infusion that day, I am responsible. I have no issues with that declaration. But he was not. And the evidence I've shown you so far, unless you see otherwise, does not support a drip. This table talks about the risk of apnea after a 25 milligram of propofol was given, and as you see there, pay attention to the time. It was not a rapid infusion. It was a 3 to 5 minutes infusion. I told the police that I gave Michael 25 milligrams of propofol infused slowly over this period of time. Look at this table that I've created for you. This summarizes the testimony of all the doctors in the trial. Dr. Shafer, which was the prosecutor's key medical witness, Dr. White, the defense, Steinberg, Kamenger, Cooper, Anderson, and Rogers. Dr. Roger is the coroner. What is the risk, gentlemen, and ladies and gentlemen, for a 25 milligram propofol infusion over 3 to 5 minutes to cause apnea? There were no comments from either of the doctors except for one, Dr. Shafer. He said there would be a risk between 5 to 6 minutes of apnea where one would stop breathing. Well, if I give this over 3 to 5 minutes, the likelihood is, if I am there, given this medication and he has any apnea, I would see it. If his heart is going to continue to beat for about 10 minutes thereafter, all I have to do is to stop giving the medication, help him to breathe, chin lift, do a simple chin lift or anything like that, and Michael Jackson would be fine. But he states that there may be a risk between 5 to 6 minutes. When asked, well, what is the risk of a complication? Again, all of the doctors basically said none, and there were no comments except for one doctor, Dr. Shafer. He says, if there would be a risk for complication, it would be less than or by 10 minutes, not above that time. When asked, what is the effect of propofol, if any, in the body, Dr. Shafer says he would expect to see a propofol effect up to 10 minutes. Dr. White, 5 to 10 minutes. Steinberg, 10 minutes, if at all. Dr. Kamenger, 7 to 10 minutes. Dr. Cooper, emergency room physician at UCLA, says little, if any. She agrees with my thought that day. I did not think I would get any kind of sedation out of Michael with that small a dose. Chief Dr. Anderson, no comment, and Dr. Rogers is the only one that stated, well, up to 15 minutes you may see a propofol effect. The level of sedation, basically none as it was expected, no one commented, and Dr. White says, if any, minimal sedation. So the thing to remember on this slide here is that the risk for apnea comes very early, if there is any, by one doctor, Dr. Shafer, but key is, once the effect of propofol is gone, what becomes the requirement of a doctor to continue to monitor the patient who is not on a continuous infusion? Dr. Rogers states, he is the one that says up to 15 minutes. I told the police 15 minutes myself to be extremely conservative. I don't have a copy of the telephone report to show you here, but it will show you, and you can look at the records. At 10:43 that day, Dr. Murray got off his last phone call. I told the police I gave Michael 25 milligrams of propofol over 3 to 5 minutes between that time, 10:40, 10:50. At 11:07, there was an incoming 1-minute call to Dr. Murray that was not answered. The next time Dr. Murray used his phone was 11:18. So let's look at these numbers and put it in perspective. So if I had given him his propofol, let's say let's say up to 10:50. It means according to Dr. Shafer, by 11 o'clock, the propofol effect is gone. And it would mean that by Dr. Rogers, if he says 15 minutes, it would mean that by 11:05, the propofol effect is also gone, and there's no risk of a complication from the treatment that I gave. The fact that I did not take up my phone when an incoming call was coming in at 11:07, and I went all the way to 11:18 before I used the phone again, leaves a window of at least 35 minutes where there was absolutely no phone usage by me. So if you take 10 minutes, for example, when there's the risk for complication, and you divide that into 35 minutes, at least if I monitored Jackson, what I call reasonable, I was there 3 times as long as I should be for that effect to go away. If I took Dr. Rogers' example of 15 minutes, 15 and 15 is 30, it means I would have been there at least twice as long for any loss of propofol effect. So I monitored Mr. Jackson very reasonably, which was more than 2 to 3 times which was expected of me. Because Michael Jackson was not on a drip, it was very reasonable for me to leave his bedside. There was no reason to monitor him beyond that time. He was not on a drip.
What is this gray area on this model?
I've now here added the 2 standard deviations in each direction.
From Dr. White's
From
research.
Dr. White's work. And it says that below this edge here of the gray, nobody would be apneic. Above this edge of the gray, everybody would be apneic. Nobody would be breathing. And what it shows is that even with this small dose, some small fraction of patients, I could calculate it, but some small fraction of patients is at risk of apnea, even from this dose, in the presence of just propofol.
Cardiac arrest. Michael rapidly injected propofol, and as they demonstrated in the trial, right in. And if you give it right in, you could expect complications, not effect from sedation as the brain normally would be. Michael surreptitiously ingested oral Lorazepam. The Lorazepam that was found in Michael's stomach was 4 times the concentration as that found in his blood. When Lorazepam is given by mouth, just like most people in your home or in your district, the most common way we give medication is by mouth. It goes into the stomach, it then drains across, it's reabsorbed across the lining of the stomach and the small bowel. It goes into the veins of these organs, and then drain into the portal vein, which transport the flow of medication to the liver, where metabolism occurs. So the mere idea that free, unconjugated Lorazepam was found in Michael's stomach is consistent with Michael taking the lorazepam by mouth. When lorazepam is given by injection, or once it gets into the bloodstream and goes through the liver, it undergoes a process called glucuronidation. It becomes bounded to a sugar. And that sugar is basically, think about a married couple. It's no longer one, it's two. If you exist by yourself, you have not been conjugated, you have not seen the liver, and therefore, free lorazepam in Michael's stomach is consistent with oral ingestion and not via an injection or infusion, and I gave him only the injectable form, not any oral medications. Michael's surreptitious ingestion of oral lorazepam was confirmed by the fact that the free lorazepam molecules were found in his stomach. When lorazepam is given in an injectable form and it goes into the blood, it goes to the liver and becomes conjugated. It binds to a sugar, and the process is called glucuronidation. Thereafter, that bounding continues. If you find lorazepam bounded to the sugar, glucuronide, then you know that that has been already, that's a molecule from the blood that has passed through the liver. When you find it in its free form in the stomach, it means that it has not yet been absorbed into the blood and therefore was never seen in the stomach, and therefore that confirms taking it by mouth. It's still outside of the body, which of course is the stomach, meaning it's not yet absorbed across the lining of those organs to get into the bloodstream. The concentration of the free lorazepam that was also found in Michael Jackson's stomach was 4 times greater than what was found in his blood. Michael's clandestine use of Demerol again played an unforeseeable role in his passing. I was completely unaware of his use of that medication, and especially to the extent of its abuse. Now, this is very important. Here you see on the y-axis plasma lorazepam in micrograms per ml. On the x-axis you see hours past midnight. I'll use my finger to tell you that 0 represents midnight. I'll also draw my hand up the y-axis and stop at this line, which is a little greater than the 0.15. This is the amount that was found, the concentration that was found at autopsy. Dr. Shafer, based upon the finding of an empty vial of lorazepam at the home, and the vial of lorazepam carries 40 milligrams total. Dr. Shafer divided the 40 milligram by 10 and injected Michael 10 times. This is Shafer's hypothesis. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 injections. That means he has used the entire 40 milligram vial on Mr. Jackson. However, he says to the jury, this is what Dr. Murray did. And he did that because he had to find a way so that by noon, when Michael passes away, the concentration would be equivalent to what was seen at autopsy. When it was brought to Dr. Shafer's attention that between the hours of midnight and 1:30, Michael Jackson was not in the presence of Dr. Murray. Neither of us had seen each other. I was at my home in Santa Monica, and Michael Jackson was on the Staples Center rehearsing at midnight. He was dancing and singing at midnight. At 12:30, he was still dancing on the stage. Sometime around 1 o'clock, Michael Jackson is in an Escalade on his way home. Dr. Shafer drops one of his 10 doses in the prior slide. See, 10 doses starting at midnight. He drops the dose and makes it 9 doses. Therefore, showing 36, 9 fours at 36 milligrams in the vial. He adjusted to fit his hypothesis. So by noon, the level would fit what was found at autopsy. Well, keep in mind again, as I told you, the reason why you see no injections starting at midnight again, because it's brought to his attention that at midnight, Jackson was still rehearsing at the Staples. At 12:30, he was dancing on stage. At 1 o'clock, he's on his way home in a Ford Escalade. Dr. Shafer then adjusts this process so that it would fit his scheme. I want to show you something else. As you notice, the levels are climbing. On this dose here, 1, 2, 3, 7, dose 8, 9, and 10. Even starting with the 7th dose, it's above this femoral blood level. As I show you the other chart that's going to come up, there is going to be a line added which is going to be not responsive to painful stimulus. And I'll explain. So here is the curve again. Shafer's Lorazepam injection versus Dr. Murray's 2 Lorazepam injections. Starting at midnight, these are the injections. He gives all 10 injections. And I promise you, there will be a curve that will show you these new lines added. So, responsive to painful stimulus. That means if Jackson is being treated, he's still able to respond if his level does not go beyond what is shown here at the y-axis. This is the femoral vein level, the line in the middle, which was found at autopsy. You see here, at noon, it comes down, it comports with the line. So Shafer gives the injections to have this level at noon. This line now is very important, and I want to show you this line. When a patient is not responsive to painful stimulus, it means that they are in a coma. It means that they're asleep. It means that no matter how you squeeze their fingernails, their toes, whatever you do, they're not going to withdraw. They're not going to respond. You're basically under. So, as Shafer shows you here, by the time he gets this dose, the 8th dose, between the 7th and 8th dose, Michael Jackson is asleep. He's in a coma. 1, 2, 3. But despite him being in a coma, he still shows Dr. Murray injecting more and more medicine. But then follow the line, because this is going to be important. This line still remains at 6 o'clock in the morning. It's still above, not responsive to painful stimulus. At 7 o'clock, if you drop a line down, it's still above that, not responsive to painful stimulus. If you look at 8 o'clock, it's still above that line. 9 o'clock in the morning, still above that line. By 10 o'clock, 10:30, the line then meets each other. Now that's interesting. And I'll tell you why. Dr. Shafer states that first of all, there were pills found in Michael's stomach. If Michael was in a coma or so soundly asleep and could not respond to a painful stimulus, do you think he'll be able to swallow pills? I don't think so. So by 10:30, he just touches the line where he's still unable to respond to painful stimulus until past the hour of 10. Now that becomes even more significant. Remember, Dr. Shafer stated what happened at 9 o'clock when Propofol. He stated that Dr. Murray started a propofol infusion on Michael Jackson that started at 9 and went all the way till noon. And he died with the infusion running. I showed you these slides earlier. Well, do you think if Michael Jackson was really beyond stuporous, in a coma, at 10, even up to 10 o'clock in the morning, does it make sense that I would then start a propofol infusion on a man who is literally in a coma and could not respond to painful stimulus? Look at that. The line is still above, up till 10 o'clock. And I would have started this propofol, supposedly propofol infusion, at 9 o'clock, when he was still unresponsive to a painful stimulus. And if he was indeed in a comatose state, and I started him on a drip of propofol to make him even more unresponsive, up till noon, there wouldn't be any way he would have free propofol and free Lorazepam in his stomach. There's no way he'll be able to swallow those pills. You know, one would have to put the tube down his throat and then maybe wash the pills into his stomach. But that did not happen. This scenario did not happen. 2 injections I gave Michael at 2 o'clock and 5 o'clock. You see the peak level? None of it gets up to where he could not respond to a painful stimulus. But I remember sitting there in my living room with all of the onslaught, and they were saying that I gave him enough medicine to put an elephant to sleep. As you can tell, that's not the case. But Dr. Shafer, although he induces coma with his assimilation, he adds a propofol infusion on top of that again. It does not make sense. It does not fit. And if it does not fit,
Beginning at 12 midnight.
Yes.
And ending, the shots end 5 hours later.
Correct.
Now, you have said, you've testified, that you read the statements from the security staff, right?
I don't know what statements you're referring to.
Did you read the statements from the security staff, from Michael Lemire, from Alberto Alvarez? From
Those are part of the material I received, I believe. And yes, if they were, I read all the material that I received.
All right. 4 milligram shot at midnight.
Yes.
And you know from reading the statements that at midnight Michael Jackson hadn't even left rehearsal.
That may well be the case. I would have to look, but that's fine if it is. Because keep in mind, you have the spreadsheets too. And the goal is to show that multiple doses can be used to do this.
Well,
You have all the simulations. I'm just trying to put together scenarios. I have no dosing records.
that would make a lot of sense if you didn't keep referring to Dr. Murray when you talked about this. What you did...
That's argumentative.
was come up with a dose to explain the concentration, and you started the shot when Michael Jackson hadn't even left rehearsal, right?
Sure, yes.
And 30 minutes later, in this simulation, the second shot was at 12:30, right?
The second shot appears to be 12:30. I can pull the spreadsheet up, and we can actually do any simulation you like.
I see.
Well, right now,
I just let me pull it up so I actually have access to the simulation you're referring to, if I may, Your Honor.
well, I think Mr. Chernoff is just asking
Yes,
you
yes.
to testify based upon that exhibit, aren't
Sure,
you?
yes. And I can give you the exact times.
Just listen to the question, though,
Yes.
rather than get to something else. Go ahead, Mr. Chernoff.
by 1 o'clock, Michael is still not home. And you'll hear the next question that Dr. Shafer asked defense attorney Chernoff. When he was asked, Was he home yet? He wanted to find out from Mr. Chernoff if Michael Jackson was home yet. But he already proposed to the jury all of these injections. Listen.
The second shot was at 12:30.
That is correct.
And you know from reading the statements that Michael Jackson was in a blue Escalade at that time, heading home.
You're telling me that he wasn't home, that's fine. So he wasn't home.
The third shot then would have been 30 minutes later at 1 a.m. Right?
Was he home then?
Almost.
Okay.
Well, based on the exhibit,
Uh-huh.
is that correct? The third shot would be at 1 a.m.?
The third shot was at 1 a.m.
Are you looking at your exhibit?
I'm looking at the exhibit right here on my laptop.
Shafer asked the question, was he home yet? But nonetheless, he postulates to the jury that I gave Mr. Jackson all of those injections. That did not occur. None of it.
We're at a level, a particular blood level, where a patient is not responsive to painful stimulus. That patient's asleep. Is that right?
That is, I would agree with that.
So, based on your Lorazepam analysis, 4 milligrams, 10 shots, by the 5th shot, the patient has exceeded your painful stimulus line.
That's correct.
Not responsive to painful stimulus. Eventually, when it was brought to Dr. Shafer's attention, the line was removed. So rather than having to deal with all of those additional injections when Michael was supposed to be unconscious, Dr. Shafer got rid of the line. And he'll tell you why.
So, based on your Lorazepam analysis, 4 milligrams, 10 shots, by the 5th shot, the patient has exceeded your painful stimulus line.
That's correct.
And as we keep going in your simulation,
Yes.
we reach a point where even at all points in time after the 7th shot, we're above that painful stimulus line.
That is correct in this simulation.
Why did you take off the painful not responsive to painful stimulus line yesterday?
I'm trying to make it as easy as possible for the jury to see the graphs. There's no particular...
Thought the jury would have...
Wait. There's no particular... What?
You thought the jury would have difficulty understanding a line like that?
These are complex graphs.
I propose that Dr. Shafer remove the line, just as he had taken a dose off the 10 injections and made it 9 and started the shots at 1:30. He removed the line because it made no sense to him that one would continue to inject a patient who was in a coma with Lorazepam. It wasn't to make the graphs better understandable to the jury. It wasn't that the one straight line will make the graph more complex. He purposefully removed that line because he was thrown off his theory, this impossible theory.
The patient, this case, let's say Michael Jackson, under this scenario, would be asleep from 2:30 to at least 11:30.
No, I would not agree with that.
Would he be responsive to painful stimulus during that time?
Because he's been exposed to benzodiazepines potentially every night for 80 days, I actually do not know.
You believe, based on Dr. Murray's statement, that Michael Jackson received benzodiazepines for 80 days? Is that what Dr. Murray said?
Dr. Murray said he'd been using benzodiazepines for a period of time prior to this, and I'd have to review the details, which I'm happy to do for you. I believe it had been going on for at least a month, and I can easily find out by going through the drug shipment records, which I have on my laptop if you'd like me to.
Well, drug shipment doesn't mean drug usage every day.
I have no medical records. I have limited access to knowing what actually happened.
So since you have no medical records, you made that assumption?
What assumption?
That since you have no medical records, you made the assumption. What significance does 40 milligrams have to you?
I limited the dose to an ampule, simply because an ampule was found. As I've mentioned, there are many possible dosing regimens one could use to get that level, but it seemed reasonable to limit it to one ampule.
Were you assuming that Dr. Murray used an entire ampule?
No, I'm simply showing that one can get to the level with repeated doses of drug, but not with not with the 4 milligrams that Dr. Murray claims to have given. That is not correct.
Actually, that's not what your report says. On the page, the last sentence, Murray, you said, did not give Jackson 4 milligrams of Lorazepam, you said, right?
Correct.
The data suggest a far higher dose.
Correct.
Possibly an entire 40 milligram vial of Lorazepam.
Correct.
That's what your report says.
Correct.
Are you saying now that you merely showed the jury this simulation because it's a possibility?
I stand by the statement as it states here. A far higher dose, possibly an entire 40 milligrams. I stand by that statement.
You did not take into consideration, once again, with regard to dose, as you worked backwards, you did not simulate anything to do with oral Lorazepam.
Not in this analysis.
I assume you prepared for the prosecution an analysis on oral Lorazepam.
I have looked at oral Lorazepam for prosecution, yes.
You, why don't you help us to understand how oral Lorazepam works?
As you can tell, Dr. Shafer selectively chose, with the DA, to not include the Lorazepam in Michael's stomach to add to his simulation. And therefore, this is why he proposed all of those injections that you saw in the prior simulations. The most common way for any of us to take medicines, as is prescribed or if you bought it over the counter, is by mouth. And it gets absorbed through the lining of the stomach, the small bowel, and gets into the bloodstream. We call that first pass. But Dr. Shafer chooses, in this case, to completely leave it out of his simulation, even though it was discussed with the prosecutor. And that's the point. This is just a slide that tells you how it works. I just explained to you what it meant. And I told you about the most common way and method to take medications, and that's that last bullet that you saw there.
what we've done here might be obvious to you, but let me describe it. We've added your simulation to the simulation did for Dr. Murray's testimony.
Yes.
Right?
Dr. Murray's
Statement. Got it. Sorry
Is that
about
correct?
Yes, that's correct.